I would recommend Roy for sedation and treatment because he understands me as an individual patient. And by that I mean that the conversations that prefaced any treatment that I had with him gave me an awareness of what was involved and gave him an understanding of the great fears that I had about treatment. Every time I've come, the team, whom I've got to know very well indeed, treat me as a person by name. I'm welcomed, looked after very cordially. I know all the nurses and hygienists, and yes, I enjoy coming very much, even to the extent when I had a long session, a 4-hour session in the chair, having crowns done, I was allowed to bring my own music, which really was the icing on the cake for me.
Roy will speak to you over the phone. You don't even have to enter the dentist, which again can be quite scary for people. And then if you just wanted to come down and sit with Roy, he will talk to you, he'll have a little chat, he won't even get you in the chair, he will sit and talk to you on a comfy sofa. It just puts you at ease. Roy is has got a way, you know, a manner, like a doctor, you know, to just make you feel reassured.
I do get value for money from the practice. I get first-class service, and I have to say I like Roy because I am still, after all these years, put at ease. And I fell across Roy. In those days we were quite a lot younger, and I think I was one of Roy's first patients, and I think, fingers crossed, I'll probably be one of his last as well when we're very, very old.
I had some cosmetic treatment done, and I do have a tickly cough, which if it's a long procedure, I sort of lie there thinking, I'm going to cough in a minute, I'm going to cough, and more or less I will cough. And when Annie did this procedure doing, Roy suggested that I have some sedation, and I just went along with it and it was fine. They know you, they always ask how you are when you come in, ask if you've been on any holidays, what you've been doing, very friendly, and I just feel as though they are my friends.
You walk into the surgery and the girls always say hello to you, which is great when you first come to the practice. And then basically Roy comes through, basically takes us through, just checks again that we're all sure exactly what's happening, check our blood pressure, and then basically puts a cannula in your hand, and so that's just a little scratch anyway. And you start to feel very woozy, very tired, and that was it basically. Next minute you wake up and it's all over and done with. No pain, no worries. You kind of think, has it been done? Because you're not even aware that the treatment's been done. You just feel relaxed, yeah. And then you just go home. So it's nice and easy, straightforward. Sometimes it can be too clinical in dentists and you feel a little bit like unsure about being there in the first place, even though you know, like, the people that are seeing. But I think it's just nice to have a smile and a happy face behind the desk, yeah.
The sedation was good. I was very, very nervous about the whole thing, but I sat down and I was hooked up to a drip, and the next thing I knew, I was waking up and everything was cool. I hadn't been knocked out at all. I was just quite relaxed about the whole experience. Didn't feel any pain, didn't feel any discomfort, didn't feel any apprehension. It was actually, amazingly enough, an enjoyable experience. So I'd recommend it to everybody, to absolutely everybody, and their aunts and uncles as well.